Hi everyone, and a big welcome and thank you for joining us tonight on our live webinar. I'll be talking about fertility tonight, and my name is Dr. Raywyn Tierney, by the way. I'm a fertility specialist and gynaecologist working here at IVF Australia in Sydney. So a big welcome and let's get started. Okay. Right, look, trying to conceive obviously is a very personal and exciting stage of life, and it certainly can be quite an emotionally challenging time. And the whole idea is really to make it your year in 2017 and giving you some great information tonight that hopefully will help you conceive in 2017. The topics I want to discuss tonight is about pre-pregnancy health, and this is all about achieving the optimum level of health for conceiving and for your pregnancy. I'm going to be discussing some of the common fertility issues. You'll also be learning about fertility assessment and tests that can rule out any potential problems. I'll be discussing some of the very simple treatment options that are available and the more advanced fertility options. And finally, I'll be giving an example and going over the IVF process for you, just to give you more of an idea of what would be happening in fertility and IVF. Okay, so what I'm going to do now is if you want to ask some questions, we'll just go on to the next page. Now, to ask some questions, you can ask any time, but we'll have actually time to ask questions at the end. However, ask any time during the presentation. And how to do that is use the live chat function, and you'll see that on the right, on the upper right. And if you're using a mobile device, you'll actually need to switch to the desktop view to see the live chat box. And you can do this by clicking on the three dots that you can see in the top right corner and then selecting desktop. I hope that's clear, but don't worry, if we do run out of time to answer questions during this webinar, we'll actually post a reply to your questions afterwards. But feel free to ask any questions, and I look forward to seeing your questions and hopefully can answer them for you. Now, certainly being at the optimum health is very important for preconception, and anything that you can do to help you conceive is very important. There are all sorts of things that you can do that will help improve your chances of preconception. The first thing, if you're a woman trying to conceive, it's very important to start a preconception supplement that contains folic acid and iodine. Now, folic acid, we recommend that you take at least 400 micrograms, and it's important for reducing the risk of a neural tube defect like spina bifida. Iodine is very important for fetal brain development, and it's important to take these supplements at least once a day. Also, it's important to have a well-balanced, healthy diet and regular exercise. And as part of this diet, really make sure that you're eating food from all the major groups and not missing out on any sort of food sources. As part of that healthy diet and exercise, the aim is also to get you to a healthy weight. And we look at weight as a body mass index, which is also short for BMI. Now, body mass index plays a great role in conception, and studies have shown that the most ideal BMI should be between 19 to 25, and you can go onto Google and have a look at that and work out your body mass index from Google. But studies show that if you have a body mass index that's less than 18, so you're very thin, or greater than 25 when you're overweight, it can be hard to conceive. But the good news is you don't need to lose much, all right? Studies show that by losing only 5% of your weight can increase your chances significantly. So a healthy diet, regular exercise, leading to a healthy body mass index can all just help with conception. And not just you, it also helps your man as well. So guys, get on board with that. It's very important that as a couple, you both do this together when trying to conceive. When trying to conceive, you need to review your alcohol intake and really have it in moderation. And I'm talking about probably between 5 to no more than 10 glasses a week. And certainly binging, we know, can affect eggs and sperm, and it has a direct effect And this effect is called oxidative stress. And so when you have too much alcohol, especially binging, we know it can lead to oxidative stress that can impact on eggs and sperm directly, and especially for men. So guys, lay off the binging on the weekend. Is actually stop smoking. And we know that couples who smoke actually have a twofold increase of infertility. And again, this works by a process called oxidative stress. And this is where free radicals are formed when you smoke, and these can directly impact on women, your eggs, and men, your sperm. So stopping smoking could actually be the best thing that you could ever do to increase your chances of conceiving. You can have coffee, that's fine, and tea. Just have it in moderation. I would say no more than 3 coffees or teas a day. But really, by being in a good optimum level for pre-pregnancy health and getting what we call fertility fit, we do know that will increase your odds of conceiving. People always ask me about stress. I'm always in a stressful job, and if I stop work, will that help my chances of conceiving? Well, in fact, studies aren't very clear. What we do know is that stress doesn't really affect infertility. However, if you're stressed and you're not getting much sleep and you're tired, then you're probably less likely to want to have sex. You're probably more likely to miss your fertile day to have sex and get pregnant. And you may well not be in a really good mental state either for you and your couple to be feeling lovey-dovey. People always ask about complementary therapies. I get this question all the time. Dr. Tierney, should I be on herbs or Chinese herbs, and should I be doing acupuncture? Well, complementary therapies are exactly that. They're just sort of complementary. And so I would recommend that you always talk with your practitioner or your doctor about that. But if you are concerned anything about fertility, then never delay and always seek medical advice. All right. So let's go on to the next slide. I want to talk about a topic about factors that can affect fertility. And for couples who are healthy, the average chance of conceiving is about 20% per month. That means that 20 out of 100 couples trying would conceive in any 1 month. So remember, it doesn't always happen in 1 month or the second month. And in fact, usually by 12 months, 80% of couples would have conceived naturally, leaving 20% there. And by 18 months, 90% of couples would have conceived naturally. And you can see on the slide here, it actually shows a graph of percentage of couples pregnant after trying. Saying that though, we know that age is the most important factor, female age is the most important factor when it comes to conceiving. It's not fair, ladies. I know Mother Nature's not kind to us. We are born with a lifetime supply of eggs. And of our eggs, they gradually decrease in quantity and quality over time and age, and especially after we turn 36 and more so after 38. So female age is the most important factor. And everyone who, many people come and see me and say, look, we're healthy, we're doing everything right, what could possibly be wrong? But you have to understand that the statistics show that 1 in 6 couples actually do have trouble conceiving. So if this is you, you're not alone, okay? It's actually very common and it's worldwide. This is just not happening in Australia as well. And as I said, female age is the most common factor, but we know that male fertility is the second biggest cause in factors that are relating to couples having trouble conceiving. And we can actually break it down into 4 areas. We can break it down to female-related conditions, and this is about 30% of reasons why couples have trouble conceiving. We can break it down to male-related conditions, and again, another 30%. After that, you get a combination of factors, both male and female, and again, that might be 20 to 30%, and it kind of leaves 10% of couples where after all the testing, we still cannot find a cause for why it's taking longer to conceive. But it's very important to know all this information, and the reason being is that you can be more informed and take action. And I'm going to be talking shortly about some of the tests that are available and treatment options for you. Okay, now how you're going to look at it is, if you are having trouble conceiving, is looking at the chances. Now normally the chances are 20%, but if there's a female-related condition, that could drop your chance down to about 5% per month rather than 20%, or even only 1% per month. If there are male-related conditions such as poor sperm, that would definitely drop it down to only 3% per month. And I'm talking about this now because when I talk about fertility treatments, treatment is all about increasing your odds of conceiving at the end of the day and having a baby. So let's go on to the next slide. And I'm going to be just discussing some of the common reproductive problems that both men and women may have and what could be slowing the chance down of conceiving. It's important to understand this because these then goes on to having fertility testing and what some of the treatment options are. And as I said, we can break it down to female reproductive issues and male reproductive issues. And the most common after female age for women is actually menstrual disorder and ovulation issues. And this is where you're not ovulating in a frequent fashion. And the most common reason is something called polycystic ovarian syndrome, which is an endocrine disorder affecting women. And about 5% of all women have this. So don't be alarmed at PCOS. I tell my ladies, deep down they're fertility goddesses because they have lots of eggs, that they're just not ovulating them. But there are many ways we can help you ovulate, okay, if you have this. So don't worry. Other female endocrine and reproductive issues is something called endometriosis. Again, this is quite common and women can often present with pelvic pain or heavy bleeding and often infertility. And here we find that tissue, which is in the lining of the uterus, or the same tissue can be found outside the uterus and can be affecting fertility and causing scarring within your pelvis. Other factors are fibroids, and these are benign lumps that can be arising from your uterus, and often they can prevent an embryo from implanting, and polyps do the same thing. They can often affect implantation and prevent pregnancy as they act like a contraceptive, almost like an IUD. Other factors is tubal disease and fallopian tubes that might be blocked. Certainly is quite a significant issue, and this will lead on to the requirement for fertility treatment. Conceive. For men, the most common reason is actually abnormalities with sperm production, either not enough sperm being produced, or they look abnormal, or possibly they're not swimming that well. Often reasons might be to do with blockages within the pipe that takes the sperm from the testes out through the ejaculate. And often if there's a blockage there, then you'll get less sperm production or no sperm within the ejaculate. Another less common is absence of the vas deferens, which is the blockage that I was talking about, and basically we have no vas deferens there, but we can do all this testing and have a look to see if there are any issues, and I'm going to talk about this with the next slide. If you are someone who's having trouble, and when I mean trouble, as I said, it's quite common for people to be trying for some time and still not conceiving. And we recommend that if you are a couple over the age of 35 who've been trying for at least 6 months or longer, or if you're a couple under the age of 35 who've been trying for up to 12 months, if you haven't conceived by then I think it's very important that you should go and have a fertility assessment, because it does mean that there may be something going on. And when I mean by a fertility assessment, I recommend you go and make an appointment with the doctor, especially a fertility specialist. You would require a GP referral. And what happens there is we would sit down with you and your partner, we would take a fertility history, and we would organise for the appropriate fertility assessment required for you to see where the issues may be that could be taking longer to conceive. So again, we recommend you get a GP referral. We would certainly look at taking a fertility history and start simple fertility tests, and occasionally you may need to go on to sort of more advanced fertility tests. You would then be sitting down with someone like myself, and we would be going over the results and making an assessment as to whether you need to have any fertility treatment, or if you can just go on and keep continuing and you'll conceive naturally. But I want to talk quickly about some of the female tests and the male tests. And of the most common tests that we would do for you and women who are wanting to conceive and who've had trouble trying to conceive is something called the AMH test, or short for anti-Müllerian hormone. Now, this is a blood test, and we call it the ovarian reserve test. Now, it's the best test we've got in the world at the moment, and it can give us an idea as to if you have a lot of eggs at this moment in time in your ovary, or possibly if you might be running out of eggs. So it's a very important test that we can do. Other blood tests that we can do on women is we can check for their hormones, and we can check for whether they're ovulating in a regular fashion. We can also check you for all your immunity and make sure that you've got immunity to chickenpox and German measles, that you're not anemic, and check for other factors as well, including general health. We recommend that you should have an ultrasound, and this is to check to make sure that your uterus is looking okay, that there aren't any of these polyps I was talking about, or fibroids or ovarian cysts. And I always get my lady to have what's called a HyCoSy. And this is a very good test. It's a test involving a special ultrasound where fluid goes into your uterus. And we can actually check to see if your tubes are open or not. The test is that many couples get pregnant after doing this test. And just by flushing a woman's tubes, studies have shown it doubles your chances of conceiving. This is one of the tests that we do to assess female fertility. For men, to test their male fertility is a semen test. This is a very straightforward test. Men book into our laboratory, and I'd recommend you have this test at a very reputable laboratory that just does sperm testing. He would ejaculate into a jar, and then this is looked at by the scientists, and we can check for the numbers of sperm present. We can check for the way they swim. We can check for what they look like. And this is sort of the common sort of fertility tests that would occur. And once you've had those tests, you would then sit down with a fertility specialist like myself, and then we would look at what the results were and make some decision around the best course of action. So remember, the reason why you would do this is to see if there is an issue, and also to give you power and empower you to make the right decision as to how to help you conceive. Remember, getting pregnant is all about the chances of conceiving. Fertility problem, then that will reduce your odds of conceiving. And what fertility treatment does, it actually increases your odds, and that's how you look at fertility treatment. But not everyone needs IVF, and I would, of the couples that I see in my clinic, really only about 10% need something like IVF. So if you go to an IVF clinic, it's not all about IVF, and all of us actually organise and offer very simple treatments. And in fact, at IVF Australia, we do offer a bulk build cycle tracking. This is for women where if you have a Medicare card at no cost, that we would track your cycle, and we can actually pinpoint your most fertile day, so you can time your sexual intercourse to hopefully improve your chances of conceiving. And we do offer that as a simple treatment for people. Some women might only require mild fertility drugs, and these tend to be women with polycystic ovarian syndrome who may not be ovulating in a frequent manner. And this is very simple treatment. It only costs about $35, and some couples may need to have that to help them conceive. Other simple treatments include injectable fertility drugs in the form of FSH injections, and you would be looking at costs of this around about $700. And the aim again is to help ovulation where you're tracked, and we can actually pinpoint the day that you're going to be ovulating, and again, you would have time of sexual intercourse with your partner. Another fertility treatment that's a very simple option is something called intrauterine insemination, which is artificial insemination. And this is where we track your cycle, and we can tell exactly when you'll be ovulating. And right on ovulation, we would then get a sample of your partner's sperm, and we prepare it. And with a good quality sperm, we actually inseminate it through into the uterus right on ovulation time to help increase the chances of conceiving. And this simple treatment does require good sperm, and it requires you to have open fallopian tubes. So this is why it's so important to have fertility assessment to see what's going on for you and your partner. Some couples actually do need to have advanced fertility treatment, and I often see women in my clinic who may have large fibroids or endometriosis, and this is where fertility surgery is very important. And often just removing endometriosis can increase your odds of conceiving, and doubling it actually over the next 6 months to help you conceive naturally. And some women might only require what we call a myomectomy. About 10% of my couples tend to go on and do require IVF, which is called in vitro fertilization, or something called ICSI, intracytoplasmic sperm injection. And ICSI is IVF, but we add an extra step and we inject the sperm into the egg. Why would we offer this? Some couples need to undergo IVF or ICSI, and the main factors would be advanced female age, where there's a shorter time window for conceiving, Another good reason would be for male factor reasons, where the sperm is not good enough in terms of numbers, so there are lower numbers of sperm, or they're not swimming well, or a lot of them look abnormal. Many couples would do this where there are factors that are related to tubal disease, so the tubes might be blocked, so there's no way that sperm and egg can ever meet within the fallopian tube and fertilise. And so fertilisation takes place outside in our laboratory, and we're very good at doing this at IVF Australia. Now, pregnancy rates are very high. We also offer something called pre-implantation genetic diagnosis. This is a very special advanced treatment that we do with IVF and ICSI. Here, when we're creating embryos, we can actually test those embryos for all the 23 pairs of chromosomes and look at the genetics in that embryo to see if it's a normal embryo or an abnormal embryo. And some couples do need to have this, especially couples where there may be recurrent miscarriage, or they may be carrying an abnormal gene that we know of, such as carrying cystic fibrosis. We can test for all of that. And we do offer this, and we're very good at doing pre-implantation genetic diagnosis. Another advanced treatment that we do offer, and we do this a lot, is actually help couples conceive through donated eggs and donated sperm. We have a very large sperm donor program if this is something that you require. So the reason why couples would need this treatment, remember, it's all about increasing the odds and chances of conceiving and having a baby at the end of the day, okay? And so the idea is that you would be sitting down and talking with your fertility specialist as to the reasons why it may be taking you longer to conceive, and what problems there may be, and if there are, what are the appropriate treatments to help you conceive. And there may be everything might be fine and you might just need a little bit more time. About IVF treatment process, and this is because 10% of my couples go through this. I want to give you an example of what would normally happen. And as I said, we're very good at IVF, and we have a very high success rate in IVF. And once you sit down with your fertility specialist and decide that IVF may be the best course of action, the process would be you would have an orientation. Now, each specific patient has her own what's called a patient care team. So you have your own fertility nurse, you've got your own fertility specialist, you have your own administration person, you have your own counsellor as well. So we have all that in place for all couples undergoing the IVF process. And the whole idea is to make it as easy as possible for you. But IVF takes about 2 weeks of treatment of hormone stimulation. And the idea is we need to grow your eggs. And then once your eggs are grown, we then take your eggs out. And to grow your eggs requires hormone stimulation. It is easy to do. We teach you what to do. You're not on your own. And we show you step by step exactly what happens. It's a little bit like giving yourself an insulin injection with a small needle. And you need to do this every day for about 12 to 14 days to grow your eggs. And as we grow your eggs, it requires us to monitor you. And this is where we have our special IVF nurses that are there, and we'll monitor you. And so between your doctor and the nurses, we bring you in probably every 3rd day, and it would require blood tests and a pelvic scan. We can tell exactly what's happening throughout your IVF cycle and how many eggs might possibly be growing and when they would be mature. Once your doctor is happy that everything looks good, we give you what's called a trigger injection. This is number 4 on the screen. Now, we call it the trigger. It's a funny word, but what it does, it's a one-off injection that you take at a specific time at night, and it does something inside your egg that makes your egg mature and changes the egg so that we can remove those eggs from your ovary. And then 36 hours later, your doctor will be taking your eggs out. We do this in our day surgery unit. It would require a day off work. However, it's only a 20-minute procedure. There's no cuts. A very small needle goes through the vagina into your ovary, and we take out your eggs from each ovary. You can be sedated, or you can have a very light anesthetic. So it doesn't take long, and you have choices there. Once we collect your eggs, your partner, he would give us a sample of sperm, and we have dedicated scientists that are right there looking at your eggs and taking those eggs, and then we fertilise them with your partner's sperm and creating embryos. And as I said, our laboratories are world class, and we're very good at creating embryos, and the whole idea is to nurture your embryos in the laboratory. We nurture them for 5 days, and these are very special, your embryos. We take good care of them, and we have very advanced techniques now, such as the EmbryoScope. We can actually look at your embryos 24 hours a day. It's called time-lapse embryoscopy. But once they're fertilised, we created the embryos, and by the 5th day, we would put an embryo into your uterus, and hopefully the plan is to have some spare ones to freeze. So I hope I've given you a little brief overview of what IVF would involve. It does look scary, I know, but we actually make it step by step. We tell you exactly what to do all along the way. You don't have to even think about it. We tell you what to do. Let's go on to the next slide. So I hope you've learned a little bit about fertility and fertility treatment options, and I know it can be a little bit overwhelming sometimes, but let's make 2017 your year to get pregnant and have a baby. So I want you to be proactive and take some positive steps and get into sort of your optimum level of health. It's all about getting fertility fit. But if you think you want to take it further, certainly make an appointment to see a fertility specialist. That's very important. To do that, you would need to get a GP referral. And the reason is GP referrals last 12 months. And it also helps make rebates better for you as well. Now, once you see a fertility specialist, they would sit down and do an assessment, and they would diagnose any sort of reproductive conditions and see if there are any issues that were going on with you and your partner. Then we would individualise a plan depending on those results. And remember, the idea about fertility treatment, if you do require it, increasing your chance to get pregnant. All right, that's how you look at fertility treatment, your chance of conceiving and having a baby. So if you would like to know more, give us a call. Call our fertility nurse on 1800 111 483. By all means, please do visit our website. It's an absolute wealth of knowledge there. There's a lot of information for you to have a look at and read. You can look at our website. There are a lot of things such as fertility doctor profiles. There are videos. There are dates of seminars that might be coming up in your area. There are tools such as calculating your fertile window and lots more. So thank you very much. And now I'm just having a little look at answer that question. How accurate? Well, just let you know, to get an ovulation kit, firstly in the chemist, it has to pass TGA approval listing, which is quite strict. They should be pretty accurate if they get a TGA approval listing. Your blood test is more accurate rather than peeing on a stick, but certainly an ovulation. Exercise is about 40 days. If you're having a reasonably regular period, then you would be ovulating in a regular period. So how you work it, and we do have that on our website, the ovulation calculation window. So go and look at that, and it will say 21 days, which is 30, and then you minus 14, which would be more. 6 would be your ovulation day. And so you probably are ovulating because it's happening regularly. And so your ovulation day is 26. So I hope that's answered your question. If you're unsure, you can be tested, all right? There are blood tests that we can do to check if you are ovulating. If you're concerned, you can always make an appointment to see one of us fertility specialists. Because it's actually very similar, and that's a really great question. Women with PCOS, okay, ladies, if you've got polycystic ovarian syndrome, then it's not appropriate that over-the-counter ovulation tests. And the reason is because they will be inaccurate and they'll give you what's called a false positive. And you'll think you're ovulating every day when you're not. Often those over-the-counter tests will be helpful for you. Okay, they're very naughty. They should tell you that on the box. And the best way would be to actually have blood tests. Now it's a nuisance. Be the most for women with PCOS. So I have another subsidised under Medicare. Yes, it is. So if you've got a Medicare card, then in fact, 4,700. So if you have a Medicare card, yes, it is subsidised. Treatment insemination, but I need more subsidised. So good question. PGD Felicia, I'm sorry, but that's not good. That doesn't mean that all your eggs are always going to be abnormal. For the older woman, I have had many couples during the multiple people cycles where everyone is on the fourth or fifth cycle. However, have a chat with another question, is it possible that ovulation is before the tracking day? Maybe you might ovulate early. Yes, not every cycle is going to be the same every month. Some women may ovulate a little bit earlier and one month you may ovulate a little bit later. That's true. And so this is why we say have sex 2 to 3 times a week if you can, to get those days where you may ovulate a little bit earlier or a little bit later. Thanks, Angela. And thank you, Sujatha. I have another question here. My question is regarding AMH. Is this more accurate than day 3 FSH? The answer is yes, it is more accurate. It's the best test we've got. Unfortunately, I wish we had a perfect test like the sperm test, but we don't have that yet. Does AMH give any more information about egg quality? The answer is no, it doesn't. What the AMH does, it tells us about egg numbers, but doesn't give us any idea about egg quality. Does it tell me how many eggs or fertile years I have? The answer to that is yes and no. It does give an idea about eggs and egg numbers. And what happens is when we get your number, we plot it on something called a normogram, where we look at it as compared to other women your age. And this can give us an idea if you have appropriate egg numbers for your age. Okay, so Theo, can it tell how many fertile years? Yes and no. It's a really good question. And we do know that if your AMH is less than 1, then you probably will have up to another 4 years before you go through menopause. And that's certainly not a good number. If you have an AMH less than 3, then we would usually say, get cracking, girl. Let's just go and get you pregnant. Forget about everything else. You need IVF. Or if you're a single woman, we're going to freeze your eggs. And so this is the kind of reason why we might do AMH. I think they're having trouble hearing me. Can you hear me now? Sorry. Someone said they missed the answer to PGD due to not being able to hear. Sorry about that. Which one? Yeah, I know the PGD question. Hopefully, at least you can hear me now. I'm very sorry if you've had lots of multiple PGD cycles and they've all been very abnormal embryos. And yes, it can be that you may be having abnormal eggs with abnormal oocytes. Doesn't mean that they're all going to be like this. What happens when we grow your eggs, there's already a predestined number that month of your eggs that are going to grow. We don't understand that, but we know that there's a predestined number and that group of eggs over there in your ovary, in that corner, they're growing that month. Next month when you do IVF, another group of eggs are predestined to grow that month. And it could be that 1 month that you do IVF and PGD, there may be a slightly little better crop of eggs that may not be abnormal. Now, we can't test eggs at the moment. There's no way to do that. But we know that as women age, our eggs deteriorate and are more likely to be abnormal genetically. Don't give up yet if you don't feel like that. Sit down with your doctor and have a chat with them. I've had patients myself who have done this and have had about 30 abnormal embryos. However, on their 4th or 5th go, they have conceived with a normal embryo through PGD. Final option would be, something to consider, would be egg donation. And this is becoming more and more often. I know it's a bit squeamish to think of it like that, but that is always an option for any woman who may be getting abnormal PGD embryos issue. I hope that answers your question, Alicia. Look, we're going to finish, and thank you, ladies, and your partners for sitting in tonight, and I wish you all the best.